To measure active range of motion for wrist extension, we're going to use the American Society of Hand Therapists method. And in using that method, the patient is seated at a table. The forearm is supported by the table in neutral pronation supination, so it's supported on the ulnar side of the forearm. The goniometer is again placed on its bottom edge. The stationary arm is simply placed flush against the forearm. The moving arm is simply placed flush against the hand so that it goes between the middle finger and the ring fingers. So this would be starting position, and that would be 0 degrees of wrist extension right there. Then I would have the patient bring the wrist back as far as you can go, way on back. Bring it way back. Excellent. And then reposition. Make sure that your stationary arm is pushed flush against the forearm. Moving arm is pushed flush against the palm, with the moving arm going between the middle and ring fingers. And in this case, we have about 0 to 55 degrees of wrist extension. You'll notice there is a gap between the goniometer and the heel of the hand, and that's fine. As long as both your moving arm and your stationary arm are pushed flush without a gap on one side or a gap on the other side, this little gap right next to the axis is not a problem.